Aspirin can help prevent heart attacks in some patients, but not all. It depends what your risk factors are, and it also depends what your risks of adverse effects from aspirin is. The current guidelines do say that low-dose aspirin should be used to prevent heart attacks in those patients who are at risk. However, a recent review showed that one dose may not fit all. To find out whether or not you should take aspirin or what dose you should take, I would speak with your physician and not make that decision on your own. In general, aspirin has risks and benefits. When we look at a population of age 50 to 60, it appears that those patients have a low enough risk of bleeding and a high enough risk of having a heart attack that they seem to benefit the most to take aspirin therapy, particularly if they have a risk of greater than 10% of having a heart attack within 10 years. There are published guidelines for those who should and should not take aspirin. But again, those guidelines predate the most recent trial data and review, which shows that perhaps a larger dose is required for those patients who weigh more than 150 pounds. Well, at ProHealth, we have well-defined guidelines that will help your physician determine the correct dose for you. I think people should know that aspirin is a drug, and all drugs have adverse effects. And that's why it's important to have a conversation with your doctor, determine what your risk to take aspirin is, and determine what the risk of having a heart attack is. There's a gentle balance here. Some people should take aspirin, others should not.